A very good evening to all the viewers. Welcome to today's chat show on Access versus Watch Group of Antibiotics. What's your choice? Clinicians in their routine clinical practice come across several infections, and antibiotics are the physician's therapeutic armamentarium to fight against these infections. However, in today's era of increased antimicrobial resistance, challenges to treat infections have increased. Now, doxycycline, a molecule of more than 50 years of existence, has gained a particular interest among the healthcare professionals in recent times owing to its unique properties. Hence, to highlight further on antimicrobial resistance, the choice of antibiotic to choose from, and the therapeutic value and relevance of doxycycline in Indian practice settings, I welcome Dr. Suresh Ade. He is MD in Medicine, Diploma in Diabetes from UK, Fellow in Neurology and Stroke, and Diploma in Neurology again from UK. He is practicing as a consulting physician at Ayush Diabetes and Neurology Clinic and at Fortis Hospital, Apollo Hospital, Terna Sayadri Hospital, and Harish Hospital. We welcome you, sir, for today's session and thank you for joining us. So, sir, highlighting antimicrobial resistance, what are the unique pharmacological properties of doxycycline that are potentially advantageous, sir, according to you?
So, good evening, all. See, basically, when we talk about doxycycline is not a new molecule. It
Hmm.
has been there. This molecule is is now also, but earlier also was used widely because this molecule. The beauty of this molecule is we don't see much of the resistance to this particular antibiotic, and it is absorbed from the GI tract very smoothly. So GI side effects are not there. That it probably there's a reason. Most of the patients, when they are not responding to the a group like ceftriaxone with metrozil in a gastroenteritis, we are adding doxycycline as an add-on drug, and its half life is around 18 to 22 hours. We can give this molecule up to 200 milligram to 400 milligram per day. It is basically even 100 milligram or 200 milligram per day is enough to control the infection. It is a water soluble basically. So probably that's the reason. No, sorry. It is a lipid soluble molecule. So uh, its penetration in the central nervous system is also good. So in the central nervous system related infections, we are using it. First of all, its stability. As I said, its action remains for a longer time. Half life is 18 to 22 hours. And the beauty of this molecule is we don't have to adjust the doses in a renal failure. So renal impairment also, we can use 200 milligram per day. So now injectable forms are also available, though for those patients who are not able to take orally. So, and in the beginning also I said this molecule has not shown much of the resistance. So resistance is a very less problem with this molecule. So probably these are the good and main pharmacological properties of this molecule.
Great, great, sir. Such a comprehensively you explained the unique pharmacological properties of doxycycline, and the key being here that it shows very little resistance or least amount of resistance among the antibiotics available. So that was great. So, sir, what are the indications where the first line indications where doxycycline can be used, as a first line therapy?
See, practically this molecule can be used in almost all the diseases.
Hmm.
If we talk about the first and the unique use, or what we can say that the drug of choice is about this molecule is this molecule can be used as a drug of choice in a scrub typhus.
Hmm.
There are certain rickettsial infection where we can use it,
Hmm.
but as a add-on therapy, it is commonly used in a respiratory tract infections, lower respiratory tract infections, acute exacerbation of chronic obstructive lung diseases or bronchial asthmas.
Hmm.
And then there are many conditions like acute gastroenteritis, pyrexia of unknown origin,
Hmm.
malaria,
Hmm.
typhoid. You name the disease, and we can't say that we cannot use this molecule because this molecule is a broad spectrum antibiotics. And
Yes.
again, I would like to insist on that this molecule, when other molecules are not working, say for example, if this molecule is not a first choice, then as an add-on therapy we have to think about this molecule.
Hmm.
So there are many indications, and most of the common sexually transmitted disease, most of the sexually transmitted diseases where the doxycycline is a drug of choice. And again, if we talk about the certain less common, or in a it's not, we can say it's a less common, but a common in a younger people, adolescents, the pimples, acne vulgaris, where this is a drug of choice. Most of the skin specialists, if we see the prescription of
Hmm.
doxycycline. So doxycycline is a
Hmm.
widely
Hmm.
used molecule, and it is a drug of choice in many conditions, like a scrub typhus and brucellosis, and add-on therapy, of course, in any condition. You name the
Hmm.
condition, I would say that this molecule can be used.
So yes, yes. So sir, here the point to be highlighted is that it is a broad spectrum antibiotic, active against multiple strains of bacteria, and also that it can be used one molecule for multiple indications. So great, great, sir. Sir, also you mentioned about pyrexia of unknown origin. So here, what we would like to know more about is doxycycline beneficial in respiratory tract infections where fever is presented as one of the clinical indications?
See, basically, pyrexia of unknown means what? The cause is not established
Hmm. Yes.
till 2 to 3 weeks. In that case, what we do, while evaluating the patient, we put patients on broad spectrum antibiotics.
Yes.
In that case, doxycycline is a molecule we always prefer to use. We always add with the higher antibiotics in some patients. In a respiratory tract infection, anyways, community acquired pneumonia,
Hmm.
this molecule is officially used many times. Most of the patients, they are, when they are, say for example, allergic to the macrolides group, clarithromycin and all.
Hmm.
We can't say that these molecules are inferior to it, but we can use, when these molecules are not tolerated to the patient, or we can as an option to it, or our choice, we can use in a respiratory tract infection. And you people, everybody present over here knows that, recently, still the pandemics are going on. We are await the fourth wave of this one is awaited. So most of the patient, they presented with a cough, cold, fever, like a upper respiratory tract infection.
Hmm.
In that situation, this molecule being a antiviral activity, also having an antiviral activity also.
Hmm.
So by default, we have used this molecule with a great success in a respiratory tract infections. It is upper respiratory tract infection or lower respiratory tract infection. This molecule has shown its efficacy,
Hmm.
and the outcome was good. So that is our clinical experience.
Hmm. Yes.
So I think, I have seen, I have discussed with my colleagues also doing that, and I could see that this molecule was officially advised by many societies to use in a respiratory tract infection, and in a pandemic for such an infection presentation as a upper respiratory tract infection, we have widely used this molecule.
Yes, great. So, sir, here you mentioned about pyrexia, the pyrexia of unknown origin, and empiric therapy started, and even in COVID, when when medications were not available, and that time also empiric therapy was started. So here, what I would like to know more about is that would you prefer doxycycline over azithromycin as an empiric therapy for multiple indications?
Yeah, of course. See, basically, azithromycin is a group of medicine having some antiviral activity, and doxycycline is also having some antiviral activity. This is one. But as I stated, the stability with which, the lesser side effects of a doxycycline are, in a clinical practice also we have experienced it that this molecule is a very safe, having a longer time of action, and then can be used in various, atypical pneumonias also, like, preferably no macrolide groups. This azithromycin or clarithromycin we preferably use in atypical pneumonias.
Hmm.
This molecule also has shown its efficacy in the atypical pneumonias.
Hmm.
So we opt to use, either azithromycin or a doxycycline.
Hmm.
But doxycycline will be the first choice because it is a cheaper molecule, easily available. It's an
Hmm.
old molecule.
Hmm.
In between, this molecule was not that used. So nowadays we don't see much of the resistance to it,
Hmm.
and we rather see resistance to the macrolides.
Hmm.
So definitely now, if we talk in today's scenario, current scenario, doxycycline definitely scores over azithromycin.
Hmm.
So I think we can use doxycycline in place of azithromycin. We cannot directly criticize azithromycin, but as I said, safe molecule, longer time of action, cheaper, easily available, and lesser incidence of resistance. So I
Hmm.
think we should prefer a molecule we should not be resistant. Otherwise, then again we have to go for the cultures and all these different things, and a lot of time wastage, quality of life, patient gets disturbed, and then money burden, cost burden, everything is there.
Hmm.
Then
Hmm.
hospitalization also, stay in the hospital also increases. There are
Hmm.
multiple factors.
Yes, agreed, agreed, sir. So, sir, you mentioned about doxycycline being a very old molecule. So, what do you think are the reasons that it is getting becoming popular now in the pandemic? Also, when you mentioned about having success, what do you think are the reasons why doxycycline is becoming popular again?
See, basically doxycycline was earlier very popular, some say decades or 2 decades back, because there were no much of the antibiotics. You understand it?
Hmm.
In last decade, lot of higher antibiotics came, meropenem and piperacillin and all the higher antibiotics that came into the market.
Hmm.
Once the higher antibiotics are available, people usually they don't want to take a risk. Sometimes lenient approach doesn't help. It is a panicky situation among the patient's relative, patient, and doctors, that many times we are very aggressive in community acquired pneumonia or pneumonias, multiple, pneumonia of any type or any other infection, sepsis, septicemia, if you talk.
Hmm.
Even in a urine tract infection, sometimes all the antibiotics are resistant, but the doxycycline is sensitive. So the reason being, in the last 2 decades, the new lot of newer antibiotics came in the market, and once the newer higher antibiotics are in the market, your natural tendency is you accept the newer ones and forget the old one. But ultimately, old is gold. So as these newer molecules were widely used, started developing a lot of resistance to the antibiotics, and that's the reason people are again back to the old molecules. Moreover, this pandemic, as I said, this molecule having, is a cheaper rate, first of all. It is antiviral drug also, it has got antiviral activity. So there are many reasons, and again I would like to insist on that there is no insulin, that there is no resistance to the bacterial resistance. So these molecule again have come back. So now the use is increased in various indications.
Hmm. Yes, yes. So, sir, highlighting again that that doxycycline being an older molecule has now gained importance because of its multiple uses and also least potential to develop resistance. So, sir, now that we are talking about antimicrobial resistance, and you mentioned about macrolides also. Now, there are reports stating that macrolide resistance is a very big issue coming up, especially in the Asian countries. So, in this entire scenario of antimicrobial resistance, where do you see doxycycline fit in this picture?
See, basically, while chatting with you, I said most of the antibiotics,
Hmm.
even higher antibiotics,
Hmm.
they were found to be resistant, and then doxycycline in a culture found to be sensitive.
Hmm.
Anyways, doxycycline is a old medicine. We have a habit of using it. We we deny that. I deny that this molecule was off use. See, doxycycline was always there.
Hmm.
Falciparum malaria, when comes in a mind or patient presents with it, doxycycline is the molecule with the artesunate.
Hmm.
Sexually transmitted diseases, anything related to the sexually, I mean, if you suspect some venereal disease or something like that, we always think about that. Skin diseases, rickettsial infection, atypical infection, we always think of those doxycycline. So again, other molecules in between the use, because a lot of new molecules came, as a habit we started using it. Later we found that these molecules are not using because of the bacterial resistance. So what we are left with it is a doxycycline.
Hmm.
So definitely, if you see the culture reports of a quite severely ill patient, most of the antibiotics are resistant.
Hmm.
So that's the reason that made us to go back to the doxycycline and start using it.
Hmm.
And this pandemic has given a lot of boost. So no old people, they again realize that this molecule is not only for the pandemic but can be used in other conditions also. And
Yes.
again, it is a least expensive antibiotic.
Hmm. Hmm. Yes, agreed, sir. So, sir, here again, highlighting that doxycycline having multiple actions and then multiple indications can be used safely. So, sir, so do you so agree that doxycycline is able to meet the challenge of antimicrobial resistance in this entire era of antimicrobial resistance?
Yeah, definitely. You see, because in the beginning only I said this is a broad spectrum antibiotic. It works against gram positive, gram negative. It also works against the anaerobic to some extent. It works against the atypical organisms. So, being a wide spectrum, broad spectrum antibiotic, we can use in any condition. And I think till it develops a resistance in near future, I mean, any molecule will not going to is not going to develop resistance immediately. But so far, it develops a insulin this bacterial resistance. We will use it widely in any condition. So there's nothing like this. Its use is restricted in particular indication and all. Add-on therapy is also used in malaria and various other reasons, as I said, typhoid and everything, everywhere, GI tract infection, respiratory tract infection, and I don't have anything where we cannot use this molecule, except tuberculosis, where there is no clear cut indication for the as an anti-tuberculosis drug. But most of the condition we can use this molecule.
Great. So, sir, also, highlighting on the WHO essential medicines list, sir, would you like to share some insights on, the essential medicine list and the aware category of the antibiotics?
See, basically. aware categories of antibiotics could be, it could be access, watch, reserve. Accessible means easily accessible drug. Watch means you wait, if other things are not helping, then if already patient is being on some other medication, and if it is not responding, then you put that petition, put on such type of medicines like doxycycline. So this molecule is now WHO has put in the access list.
Hmm.
So, and WHO has put it in that particular list, where these drugs are easily accessible to the patients, or can be used almost as a first line treatment. Various like uh, any condition like respiratory tract infection, exacerbation of COPDs or bronchial asthma, urine tract infection, add-on therapy in malaria, enteric fever, first line treatment in scrub typhus, rickettsial infections, then sexually transmitted infections. So it is there in access group, watch group, and reserve group.
Hmm. And sir, that doxycycline is included in the access category, and azithromycin is included in the reserve category. So, sir, would you like to highlight more on the fact that azithromycin is there's a reason why azithromycin is included in the reserve, the watch category.
See, basically, reserve means what? Reserve means this drug is reserve. Reserve is reserve for something else.
Hmm.
Say, for example, if patient is not responding to the multiple drugs, multiple. If say, for example, patient of a sepsis is not responding to multiple drugs, then what? Then this molecule is reserved. So this molecule, doxycycline, is reserved for use in that particular condition. So that this molecule being a less resistant to the, or less have a less tendency to develop resistance, this molecule is in a reserve group. So this is my understanding about the.
Sir, just to
I'm going in a wrong direction.
Sir, just to doxycycline is in the the axis group, and azithromycin is in the watch group. So,
So yeah, see it, but it could be in a reserve group also. Access group is doxycycline is in the access group, right?
yes, yes,
Azithromycin is in a watch group.
yes.
But if we if we just go by the name reserve group, can't we understand that if multiple drugs are failed where this molecule is reserved, in that context I was talking about.
Okay,
Okay,
okay, okay.
so doxycycline is put as a access group by the WHO.
Hmm. Yes.
Okay.
So, yes. So, sir, great, explanation to the entire foundation of the molecule, and how it has worked in multiple indications, and how it is still effective, and it shows least resistance potential to infections. So, and as compared to azithromycin, it is still a safer and cheaper drug that is available for economical for patients to be used in multiple indications. So here, sir, I would like you to give a final any message for the viewers who are watching this today.
See, basically, I think no much more discussion is required for this molecule. The audience is wise enough to understand that this molecule has been put in a list of essential drugs by WHO. National list of essential medicine also, prepared on 2015, also mentions, NEGM also mentions about this molecule. This molecule is a broad spectrum antibiotic, can be used anywhere. Then bacterial resistance is the suspected thing, not cannot be proved in the cultures. That time also you can think of adding this molecule. Its interaction with other drugs are not that common. So it is friendly with the other antibiotics. So I mean, beauty of this molecule is that it doesn't hamper the absorption or pharmacological properties of many drugs. So in that case, say, we don't have to reduce the doses of other molecules. So if you are liberal to use a molecule where there is a less chances of bacterial resistance, easily available, cheaper at rate, broad spectrum properties, at in many conditions can be used as a first line treatment. Add-on therapy is also very 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 helpful. It's other group like a tg-cycline of its type can be used in a severe infections, also in the hospital can be used. If you have a such a great property of a molecule with a lesser side effect and all these good properties, then I think we should always think of using this molecule. Always keep doxycycline in a mind and try to use it. If nothing is there in your mind, then please keep doxycycline in your mind.
Great message, sir. Great message to all the viewers. If while treating empiric treatment is, what is suggested. Sir, it was a great session, and I thank you for such an interactive and for answering all the questions in such a detailed manner. And I thank you so much for your time, sir, for today.
Okay, thank you very much. Have a nice time.
Thank you,
Good
sir.
day. Thank
Good
you.
day.